are supplements necessary, and what do you recommend?
Well, so it depends on what you mean by necessary. There are some supplements, though, that I think most people could use. One is magnesium. Um, magnesium Magnesium has been depleted from the soil, and especially when people are eating a lot of processed foods, then they're not getting enough magnesium. Furthermore, if people drink caffeine or alcohol, this promotes basically wasting of magnesium. In other words, you excrete more magnesium than somebody who doesn't drink these things do. So I think most people can use magnesium as a supplement because magnesium is just so associated with better health outcomes. Basically, I don't think it would be an exaggeration to say that the more magnesium people ingest, the healthier they are. Um, Vitamin D is another one. So, you know, the best thing to do, of course, is to get vitamin D from the sun, but a lot of people can't do that because they live in northern latitudes, or it's winter, or any number of other things, or they work all day. I mean, it used to be a couple hundred years ago, basically everyone worked outside, and so they would get some sun, at least seasonally. So vitamin D deficiency definitely should be remedied. And so vitamin D supplementation, I think, is appropriate for many people. Um, Another one I like is vitamin K2. So this is a vitamin that is very important in vascular health. In other words, arterial health, basically keeping calcium out of your arteries. So the thing about vitamin K2 is that it can be kind of difficult to get in food. Like the biggest source of vitamin K2 is pastured dairy. Like for example, Kerrygold butter, which is comes from Ireland, from pastured cows. So a lot of us aren't eating too much of that kind of thing. And so I think vitamin K2 can be a very healthy supplement to take.
Right. So going back to the training part of things, as folks get for older folks, would you recommend like they stick to one type of training, that is like specificity in training, or you would suggest that they would try different sort of movements?
Well, I think that everyone should do strength training. And I think that this applies to, even the, little old ladies or little old men, basically everyone. In high intensity training, the beauty of high intensity training is that anyone can start from where they are. So like I said, it's not about lifting super heavy weights or anything. You start with whatever your current level of strength is and go to failure. So everybody can do this. Of course, there's going to be some exceptions if somebody has, health problems, or, some kind of limiting factors, disabilities, whatever, that prevent them. They should probably get, good coaching, maybe physical therapy, that sort of thing. There is, in high intensity training, one thing is that if it's done properly, if people are going to failure on the exercise and then using minimal rest between exercises, you can get a good cardiovascular workout doing this. You can get a high heart rate going, be breathing hard throughout this workout. So if done properly, it is good cardiovascular conditioning. Now, that said, if somebody wants to do something that is, what we might call traditionally cardio, there's certainly nothing wrong with that. So, people should find out what works for them. I would also say there's a couple of things here, that we should distinguish between exercise and physical activity. So exercise, I would define as a structured activity that you that is designed to improve your fitness. Okay, physical activity is basically anything else that you do while moving, anything else other than, sitting or lying in bed. Okay, so, for instance, gardening is a physical activity. Doing the laundry is a physical activity. Um, for many people, walking, for example. Now, so it depends on where you are in health terms. If you got somebody that was in a nursing home and you got them to go out walking, this is going to be a stressful enough activity that it is going to improve their fitness. For many of us, most of us, I don't know, maybe not most of us, but for many of us who do structured exercise, something like walking or any other physical activity doesn't rise to a high enough intensity to improve our fitness. However, it is a healthy thing to do. Everybody should be moving in some way daily.
Right. In your book, Dumping Iron, you emphasize that high levels of iron can be harmful, especially for men. Can you shed more light on this? And what are the ideal ferritin levels as per your?
Right. So, yes, especially in men, women via menstruation have a way of basically dumping iron. So up until menopause, men obviously don't. So men can accumulate, and some women too. I don't want to leave that in, and especially after menopause. But for middle-aged and older men, especially, this can be a problem. Ferritin levels can rise quite high. Uh, Many men and women have, they will have some kind of genetic polymorphism that leads to them um, absorbing and absorbing more iron. When you absorb more iron, the thing is there's no regulated way of getting rid of it, and so ferritin levels can rise high. There are other factors too, metabolic dysfunction, which, as I've said before, is rampant in the United States, can lead to dysregulation of iron metabolism. So iron, like so many other things, is highly regulated as far as your body will regulate how much of it to absorb, and so on. So if you are iron replete, if you have enough iron, at least in theory, your body is supposed to stop absorbing it. But we see in many cases this does not happen due to metabolic dysfunction. Iron regulating hormones are dysregulated. So there's all kinds of evidence showing high ferritin levels being associated with worse health outcomes such as heart disease and cancer. So and in aging, this has certainly been shown in animal studies that excess iron accelerates aging. So I think this is something that people should be aware of. I think men in particular should at least once in a while, or hard to say how often, but find out what their ferritin levels are. I've come across many people that didn't know their ferritin levels. They got it tested and it was very high and they had no idea. In the extreme, there's a disease called hemochromatosis, and these people have they will absorb a lot of iron, and this causes severe health problems. These people can have ferritin levels, in the thousands. Um, what is an optimal ferritin level? I believe that an optimal ferritin level is less than 100, and many people, especially men, have ferritin levels higher than that. And so this is one biomarker that I think they can look at and take action if necessary. The most obvious action being blood donation, that lowers ferritin.